Interprofessional education is really defined as whenever two or more professions are collaborating together.
So we learned a lot about each other's professions, how we could all work together.
Whether it's in learning, providing service, or doing research.
Even when we did bump up against, the typical kind of challenges that you might have working interdisciplinary, we learned so much from those challenges.
Our ultimate goal is to transform how healthcare is provided.
I think it's beneficial not only to start thinking as students how we can apply those when we're out in the real world and working, to have respect for those and hopefully transform the way patient care is administered.
Each year we've built on what we've done before, but this has been a particularly exciting year. We had, for example, in September an orientation that included 400 students from over 8 disciplines, all involved in studying a similar case together. We have had classes in social work and physical therapy combining, doing role plays together, also exploring how they could practice together in the field.
I really found it beneficial to discuss the tasks of a physical therapist and then of a social worker and how they could work together. Put a face with an injury and just kind of see the effect it can have on them socially, physically, emotionally. You can read about this stuff, but actually seeing it really hits you that much harder.
We had an interprofessional case study, again, that involved 8 disciplines. I think it was quite impressive, in particular in that the students each talked about the experience of the other students rather than just their own. And you could see the insight that developed for them.
It's our responsibility to look at ourselves as healthcare providers and really see, are we providing consistent healthcare across the board? Are we working together as a team to really show that each patient is getting, continuous care that feels supported, non-judgmental?
The exploration of art as a method to understand both how we work together and how we improve relationships with patients and clients, including body art with one outside speaker, also our collaboration with Adverb Productions, and they do theater for health and wellness education. Another very exciting development in the last couple of years is our Ghana Health Mission.
The Transcultural Immersion in Healthcare program started in 2008. This has involved bringing numerous health professions to Sekondi, Ghana to deliver healthcare services that this community has never seen before. Everybody is an equal part of the team. Gain an appreciation for teamwork that's respective of specific disciplines.
We really focus in interprofessional education in 3 key areas. One is in learning together, that is what we do in the classroom and how we teach. The second is what we'd like clinical service to look like. So one of our goals is really to get our students together in collaborative learning teams out in the community. I think it's very exciting that this fall, the fall 2010, we'll have 250 undergraduate students in applied exercise science, athletic training, occupational therapy, nursing, and dental hygiene, all entering their freshman and sophomore years taking the same classes together. We're one of the few universities in the country that's doing anything like this, and we expect and hope that this will provide all those students an opportunity to be exposed early on to the concept of interprofessional work, and that will kind of whet their appetite for it in later years.
Our classes might meld, and we're really there to have those conversations together, because I feel like if we're able to do that at the education level, then when we go out as professionals, we'll already have that. Like, that was embedded in our education, and it'll really be embedded in the way we work.
At the end of every year, students say, I wish I'd had more opportunities to do interprofessional education.
Was for so long of just being lectured to and giving chapters to read and having to read out of a book. And you can't teach this stuff out of a book.
Being immersed in it in an educational setting really brings the concept alive.
A lot of us are hands-on learners. You can read about this stuff, but actually seeing it really hits you that much harder.
I'm really proud of UNE for taking on these kinds of issues.
Transform the way patient care is administered.
Collaboration saves lives.
These activities model what we believe in.
We learned so much from those challenges.
To transform how healthcare is provided.
Whoa.